Welcome to Nurse Horizon channel. Here we are with 15 challenging questions of respiratory system. Please subscribe our channel and press the bell icon for everyday notifications. Which of the following not a common characteristic symptom in tuberculosis? And the options are cough with mucoid sputum, anorexia and weight loss, chills and night sweats, high grade fever. And the answer is yes, high grade fever. Why? Because unless complicated, low grade fever is a common and characteristic symptom in TB. All other options are common in TB. Which of the following is a best method to deliver a precise oxygen concentration administration in a client with chronic obstructive pulmonary disease? And the options are tracheostomy tube, face mask, face tent, and Venturi mask. And the answer is Venturi mask. Rationale: Venturi mask facilitates fixed high flow and controlled delivery of oxygen. Hyperoxygenation is recommended before endotracheal suction. This will prevent in complications such as, and the options are cardiac dysarrhythmias, atelectasis, pneumothorax, and bronchiectasis. And the answer is yes, the complication is cardiac dysarrhythmias. Here is the rationale. Suction removes oxygen and decreases arterial oxygen level, leading to hypoxemia, which will be causing myocardial hypoxemia, finally result in cardiac dysarrhythmias. Which of the following is an immediate management of status asthmatics? And the options are IV B2 agonist, oral corticosteroids, inhaled B2 agonist, inhaled corticosteroids. And the answer is yes, inhalation of B2 agonists. As we all know that B2 agonists such as salbutamol, it promotes bronchodilation since it's a bronchodilator, which increases oxygenation, and its inhalation finally results in quick relief of asthma symptoms. So inhalation is recommended. The tuberculin test reveals an induration of 7 mm in a HIV client. The best nursing interpretation to these findings would be, here the options: test positive, test negative, repeat the test, and false negative. And the answer is test positive. Why? Normally an induration of 10 mm or more indicates exposure to TB and considered as test positive. However, an induration of 5 mm or more in an HIV client indicated as test positive for tuberculin test. 6. Barrel shaped chest is seen in, options are emphysema, bronchial asthma, obstructive pulmonary diseases, atelectasis. And the answer is emphysema. What happens in emphysema? It's a condition characterized by diminished airflow. So alveoli become hyperinflated and the diaphragm is flat, leading to increased anterior-posterior diameter, causing barrel-shaped chest. Which of the following clinical finding can be seen in a clinic? And the options are rapid and deep respiration, slow and deep respiration, paradoxical respiration, pain on inspiration. So the answer is pain on inspiration. So a fractured rib is manifested as pain at the fracture site, which will be exacerbating on inspiration. Shallow respiration, splinting and guarding the chest will lead to decreased chest movement. Physical examination of a client reveals absence of breath sound in the left lobe of the lung. This may associated with, and the options are pneumothorax, emphysema, acute respiratory distress syndrome and pulmonary emboli? And the answer is pneumothorax, where in that there is restlessness, tachycardia, and absence of breath sounds or diminished breath sound, please note, is seen in pneumothorax. Question number 9. Which of the following is a clinical manifestation of flail chest? And the options are dyspnea on exhalation, cyanosis, paradoxical chest movement, and hypotension. And the answer is paradoxical chest movement. What is meant by flail chest? Is a fracture of two or more ribs in at least two places. And what happens in paradoxical chest movements? The force of the inspiration pulls the fractured segment inward while rest of the chest expand. Simultaneously, during exhalation, fractured segment moves outward and rest of the chest moves inwards. This is called as tellate sign of flail chest. Prompt intervention for a client with bronchoscopy or after the biopsy. Options are frothy cough, bronchospasm, blood-stained sputum, and hematemesis. And the answer is bronchospasm. Rationale: complications of bronchoscopy include bronchospasm, dysarthmia, cyanosis, respiratory stridor, and hypotension. However, blood-stained sputum after bronchoscopy can be an expected finding. Benefit of pursed lip breathing in a client with obstructive pulmonary diseases would be, and the options are: it promote oxygen inhalation, it promote carbon dioxide elimination, it strengthen the diaphragm, it strengthen the intercostal muscles. So the question is, among this, which is the most benefit? So the answer is yes, pursed lip breathing promote carbon dioxide elimination by facilitating maximum expiration by increasing airway pressure and promoting better expiration. Which of the following would be a possible reason for spontaneous pneumothorax? And the options are tracheoesophageal fistula, rupture of subpleural bulb, a wound in the chest wall, pleural friction rub. The question is, which is the most possible reason for spontaneous pneumothorax? And the answer is rupture of subpleural bulb. Spontaneous pneumothorax occurs with rupture of the bulb, which is also called as air-filled and cavity, just like a blister. Now, the signs and symptoms of this are a sudden unilateral chest pain, which is affecting on the affected side, and the shifting of mediastinal contents into the unaffected side. Please note what happens. There is a shifting of mediastinal contents into the unaffected side in spontaneous pneumothorax. Question number 13. The nurse should observe carefully for which of the following in a client with COPD receiving oxygen at 2 liters per minute via nasal cannula? And the options are increased respirations, cyanosis, decreased respirations, anxiety, and tachycardia. So which should be closely monitored? And the answer is decreased respirations. Administration of high concentration, that means around more than 2 liters per meter. Yes, oxygen may decrease the respiratory drive, leading to decreased respirations and lethargy. Note anxiety will occurring. A client had a foreign object in the larynx and Heimlich maneuver is advocated to expel the same. The nurse understands that this will help to remove which volume of air in the lung? And the options are tidal volume, residual volume, vital capacity, and inspiratory reserve volume. The question is, in Heimlich maneuver, which volume of air is expelled? And the answer is residual volume. What do you mean by Heimlich maneuver? A sudden strong pressure is applied on the abdomen between umbilicus and rib cage in case of any obstruction in the larynx. With this maneuver, residual air is expelled and dislodging the obstruction. Which of the following positions facilitate maximum lung expansion for gas exchange? And the options are supine position, semi-Fowler's position, prone position, and orthopnic position. The question of the day and the last question is, which of the following position promotes maximum lung expansion? And the answer is orthopnic position. The rationale is, in orthopnic position, the client sits an upright position supported with a pillow. This enables the client to press the lower chest over the table, permitting the diaphragm to descend by gravity, facilitating maximum air exchange. Let us go of lung capacity and volumes. Lung volumes, an approximate of tidal volume is 500 ml and residual volume 1200 ml. Expiratory reserve volume 1200 ml. Inspiratory reserve volume 3000 ml. Let's go for a quick revision in such a way that tidal volume is always very small and residual volume ERV both are equal, and most higher is IRV, that is inspiratory reserve volume. Let us go for the lung capacities, starting from the higher total lung capacity, which is also called as 6 liter total. It's around 6 liter. Vital capacity around 4.8 liter approximately. Functional residual capacity is 2.5 liter. Among these three, vital capacity is the most important question that is frequently asked, which is around 4.8 liter. And let us wait for the another video and stay tuned for every 15 minutes for a 100% success. Please subscribe our channel and press the bell icon always for getting the day-to-day notifications. Thank you.